from different members. And as I look back on the January minutes, I noticed some detail added to those with, Sheriff Fuller said that, Jim Rutherford said this. On our minutes, I see two words, discussion ensued. I would like to see some more detail, at least highlights of what everyone said at the last meeting, so we have it in the record. I believe all of us signed up on this to be heard and to be recorded. So can we do that? Correct these minutes with highlights from the previous meeting and make sure that this meeting contains highlights from what is said during the course of the meeting.
Thank you, Mr. Gladstone. Let's have some discussion here. What is the will of this body? Do we want to see deeper revision to the minutes and those to be presented for our review at a future time? Typically, the minutes are not a dictation of the meeting, but we certainly do want to capture what is occurring. We do have a recording of the meeting that is available. So what's the will of our body? What would we like to see?
Madam Chair,
Yes, Sheriff.
I think condensed versions are just as good, especially given how much we do discuss. I find that quite the onerous work for somebody to have to sit there and do every single word. But I do recognize that there is a need to have certain other pieces in there. I do like the fact that it is recorded also. And we've had some concerns in the past on other boards where we went back and had to look at the minutes on the video, and it wasn't a terrible task. It was easy enough to do. So I think the way we're doing it right now seems fine, unless there's something really big that we discuss.
I would concur. It's appropriate to have a condensed version. I don't think we can record Sheriff Fuller said this and Dr. Ford said that, Dr. Nettleton said this, and I said that. I think condensed is appropriate. We can look at the minutes and proceed from there.
Okay.
Madam Chair.
Mr. Gladstone.
So the January minutes did have some highlights. I'm not asking for a transcript. My suggestion is that we have more than discussion ensued, because I would like to have gone back. I didn't have access to the recording and would like access to the recordings. Also, discussion ensued doesn't refresh my memory on what we discussed at the previous meeting. So bulleted highlights, a summary of important points, not every word, but important points would be my suggestion.
Thank you, Mr. Gladstone. Any other thoughts from the body? All right, so what I'm hearing is a general consensus that we are all right with abbreviated minutes, though it would be good to capture the essence of a conversation, but a full dictation and detail is not necessary for our purposes. And we'll have access. And Mr. Gladstone, I'll seek prior recordings if you'd like to see those, see if we can get access to you for those.
So will these minutes be updated then, based on what we just decided?
Well, we have we'll consider a motion if we want to approve these minutes, or do we want to refine them? So that would require a motion. Motion to approve the minutes by Sheriff Fuller, support by Vice Chair, or by Chair Ray, rather. Any further discussion? Yes, Commissioner Hepler.
Just to add the names that were missed in I think that's important.
Thank you, thank you.
And I think getting Mr. Gladstone the ability to view the entire transcript is, I think, paramount. Thank you.
Good, thank you. So Sheriff Fuller, do you want to restate the motion for the minutes as amended with the listed attendees?
I do. So I move to approve the amended with adding the attendees otherwise approved.
Thank you. Okay. Moved by Sheriff Fuller, supported by Chair Ray. Any further discussion now? All right, seeing none. All those in favor say aye. Aye. Any opposed? Okay. Motion carries. Thank you very much for discussion. All right, my computer likes to go back to sleep very quickly, so let me get it back open.
Chair.
Thank you. Yes, Administrator.
I just wanted to highlight that we are experiencing technical difficulties again with our technology as we did last night. So we are recording this meeting, although we don't have the TVs on right now. So that meeting is being recorded, and then we'll be working to get, right now, we only have our recordings and our meetings on our YouTube channel from the Board of Commissioners meetings. But we'll be looking at, since this is an ad hoc committee, working on getting that uploaded, but just wanted to have those assurances provided regarding the recording tonight or today and the importance of using our mics, because we don't have the visual. It will only be what is actually said here with your mic on.
Thank you, Administrator, and an ongoing conundrum with our technology. So hopefully those issues can be resolved soon. But thank you for that clarity.
Quick follow-up question. How long are those stored? The tapes of the meetings, just out of curiosity?
I think with our Zoom technology that we have a capability of getting any of the recordings that we have. I would have to check with Dina. Once we put them on YouTube, they're on indefinitely, I believe.
So I would think that having access to that should help satisfy your desire to be able to go into depth when necessary.
All right, thank you. So let's move on to number 4. This is opportunity for public comment. So it's the time for any members of the public to address the opioid settlement task force. You can come to the mic up to 4 minutes to speak on a topic of your desire. All right, seeing no members in the gallery and administration with our technology issues, would people be able to still comment online, or is that not available today?
They should still be able to, and I'm asking now if we have any hands raised.
Chair Stubbs, there is nobody online to comment.
Thank you so much, Dina. Okay, so let's move to item 5. So we're going to discuss through some additional resources. So we had discussion last time about the depth of the community needs assessment that we've been able to review. And so administration just did some follow-up for us, noting that we had 670 total responses, which I think may be more than the state garnered in the statewide assessment they did from what I remember, if I reviewing the data, if I'm remembering accurately, lots of numbers sometimes. But so a pretty good turnout. They note for us, it's not a formal study. And so we didn't have a specific number that we were trying to hit. The goal initially was set at 644 and we did exceed that. So, but it doesn't mean that we're done listening to the community, but it does mean that we did get sort of the participation targets that we were seeking. And then they provided us within the agenda some of the breakdowns of the community-wide survey, which included 563 respondents. And we could see the percentage of how those broke out among people with lived experience, loved ones, and other community members. Did we have any other thoughts or questions that we wanted to pose for administration around the needs assessment or the additional data that they provided to us today? Mr. Gladstone.
Just a quick question. Would there be a mechanism in place if someone asked me, how do I contribute to the ongoing needs assessment? Is there some sort of mechanism in place to, as you said, we're not done yet, to have some input for the future?
I think that's a good question and one that could be tackled by this body. So it's really for us to determine other ways that we want to seek engagement or information sharing. We could hold additional listening sessions. The ongoing data collection of the actual survey that's already conducted is closed at this time. Is that correct, administration? So beyond that tool, other mechanisms that we want to employ are really up to us. What do we think is an effective way to really hear and engage and make sure that people, are involved in the process and have a voice in it? Director Rutherford.
So, correct me if I'm wrong, but I believe that this particular assessment was done in unison with representatives from Michigan State University. And I don't know if we encountered an expense associated with that. For programs that have a millage, for instance, so my area agency on aging program, the veterans program, we incorporate into the budget every whatever frequency, 3 years, 5 years, annually. We incorporate funds to be able to assure that in perpetuity that a needs assessment is completed. So that would be my recommendation to assure that, because when I got here, the needs assessment that I had for the seniors was going on 12 years old. And that's really of no value because things change so rapidly in terms of what the needs are and circumstances and such within a respective community. So my recommendation at a minimum would be that you incorporate that element into the budget and the process be incorporated into, however, what the frequency is, and ensuring that that needs assessment is completed, and probably more frequent than not.
Commissioner Hepler, Pro Tem rather.
It's Jeff. Thank you. Thank you, Chair. I agree with what Mr. Rutherford's sharing with us. I guess because this is going to be limited, because the funding is only going to be available for a short period of time, that this probably should be done a little more regularly within maybe a year or so, but have some kind of ongoing process where somebody, they can come to these meetings, obviously. They're open to the public. That's what we're here for, to hear from the public, to discuss these issues. But to try to get these things, as Mr. Rutherford pointed out, things are changing rapidly, especially in this. I happen to have some data that showed up at my doorstep with, showing that Kalamazoo County, hey, we made number 2 as far as fentanyl possession in the state of Michigan. We weren't even outdone by Wayne County and a few of the other bigger places. So I think we need to gather this information as it comes in timely, and then do the needs assessments as we can with every maybe 2 years.
Dr. Nesbitt.
Yeah, I think continued engagement's always good. I just want to reiterate that this survey was pretty robust, more so than other communities throughout the state of Michigan and the United States. I think there is that ongoing community expectation to take action. And I think when we do take action, folks can see, and then that's also opportunity for re-engagement. Then a question for Administrator Smith. There wasn't a listening session, I believe, that the county held, correct? And it wasn't well attended.
Yes, that is correct. We did hold a listening session at the end of the needs assessment due to people indicating a desire to have additional engagement. And yes, it probably was our least attended.
And that was on the news. And so I guess my point there being like, this was, a robust survey was done. This was advertised in the news. People did not attend that meeting. So for me, that's an indication that there may be a saturation of a gathering of information at this point. So that's just my thoughts for consideration.
Thank you. Okay. All right, I'm going to move our discussion forward to some of the attachments we received for Exhibit E. So maybe I'll inquire, Dr. Nettleton, this was something you elevated to ensure it was shared out with the body. And maybe you could provide some insight about what's important for us to glean from Exhibit E and how it can help us sort of understand the guardrails that we're in within our work.
Yeah, I think that it's helpful to do that. Exhibit E kind of, it's broad in the sense of strategies that are available, but also specific enough to say, hey, this is something we can take action on. So it has that 1-2 type of characteristic to it. It's also in parallel to what some focus has been identified through the Kalamazoo County Opioid Coalition. So for example, stigma reduction, medication-assisted treatment, harm reduction through naloxone or fentanyl test strips or in-services program, but also other things that haven't been talked about probably as in depth, such as neonatal abstinence syndrome is included here as a possible intervention. Oftentimes is maybe less forgotten about outside of a clinical setting. So it just gives a nice framework of a menu of options for the committee to peruse and then to make recommendations to the board about. It provides that framework.
Thank you, Dr. Nettleton. And so as we've hopefully had some opportunity, well, and there's more time to digest. I mean, our work will be ongoing, but I want to make sure we're making good constructive use of our time here and we're moving to action. So do we have other thoughts or observations that any of our members, saw within materials in Exhibit E that maybe they want to lift up as part of this discussion today? Or we note that we have that material, we'll continue to review as we go through our discussions. Anything else anyone wants to just elevate? Mr. Gladstone.
Thank you, Madam Chair. There's a lot of great information in Exhibit E, and I started to glance through it and did not have enough time to circle, underline some of the key things that we could do. Perhaps maybe by next meeting, we could address this and give everyone a chance to read through Exhibit E and do the same.
There's a lot of material. I understand we received a lot. I think that's advisable, and I just wanted to see if there were any first thoughts. So we'll continue to process that information. The next additional material we received was the planning template. So administration, you want to just share a little bit about what that tool is and how that can be useful to us?
Yes, so from the last meeting, I was asked to share any resources that I had from what the state is planning to do with their funding. So that's truly what I provided. This is from their fiscal year. The MDHHS's spending plan, their planning overview. So it really was just fulfilling a desire that this task force brought up of wanting more information of what the state is planning to do with the funding and what MDHHS has released for fiscal year 23.
A lot of detail, a lot of strategies and interventions, and certainly a lot of resources across the state. I think one of the things I'll note too, that, we got a link to some of the state resources, and it talks about allocations made across the state into other municipal bodies within Kalamazoo County. And, maybe that also will be portion of our discussions, is how we as county government work and collaborate with other local units, our cities of Parchment, Kalamazoo Township. They've also received opioid settlement resources. And so, helping to just unify around, sort of see what the state is doing, make sure that we're not doing like overlapping, but collaborative work together. And it's challenging to do that, but that will be important in what we have in front of us.
Madam Chair.
Yes, Mr. Gladstone.
I hold up a copy of a book. This is the 2024 annual report from the Opioid Advisory Commission, reports to legislature and ultimately to the governor. And this is available online now, the 2024 annual report. Don't be too intimidated. There's a lot of appendices. So a wealth of deep dive information, but the beginning portion of it are recommendations from the OAC. So that may be a tool also, and just call attention to that. And it is available for download online.
Thank you, Mr. Gladstone.
And Chair Scrubs, to your point,
Yes.
I do think it would be helpful, I don't know if we designate a person or we just collaboratively think about it, is have a timeline or have a framework for what tangibly the state is anticipating, has done in terms of RFPs or will do for RFPs. And that may give us a way to align and not duplicate. And that may be available. I haven't looked at that new Attorney General website that just came out, the Deputy Administrator Smith sent out. And so that alignment, there may be a document, it may not be this one, but we know, hey, the state is planning some dedication on this area so we can strategize as a community to perhaps go for grants on the private or public level there. And then, hey, since that may be coming, we can focus local funds that we've received on another area. So I'm looking for that resource, I guess is, I think I would encourage, whether it's from the state or we have a crosswalk for that.
And I think if we can identify those resources to help us see sort of those state strategies, being able to be a convener with the other local units, so that we're helping just to ensure that they're aware as well, so that they're not, again, duplicating work or targeting resources in an area that's already potentially identified in
And I
some
wonder
way.
if the Michigan Association of Counties would be a good resource for that. Maybe they have a rubric or a framework that they could briefly share.
Madam Chair.
Mr. Gladstone.
Since you mentioned grants, one of the things that came up at the OAC level that is under discussion is providing grassroots organizations, small organizations that perhaps maybe they only have 1 or 2 employees. They don't have a director of development. They don't have a grant writer. Creating low barrier access so that it's not the typical county RFP that requires, a 20-page, 30-page document, something that's low barrier funding. I just want to put that on the radar since Doctor mentioned grants. I don't know if that's something we would discuss at this point, but it should be on our radar to create low barrier grassroots organizations the opportunity to have access to funds that they may never have access to otherwise.
Well, I think, particularly from our service provider perspective, thinking about those barriers to get in. I know, our work here at the task force and the county commission has had a focus through other allocations, be it our housing millage or ARPA funding allocation, really trying to target and support grassroots organizations. And I think to Mr. Gladstone's point, in this work, those are really critical partners in these efforts because they're right on the ground with built relationships with the most in-need community segments, right? And so, I'd love to hear some perspective from our providers. I mean, when you've been faced with trying to obtain these types of funding, what are those barriers and how do we elevate that so we can be aware when we go to launch opportunities for funding to make that accessible for people?
I think part of the barrier for the grassroots or the smaller organizations is knowing that there's dollars available. And we find out there's dollars available later than when they first come out. And so how do we become a part of that conversation, or how do we become a part of you all sending out emails or whatever packets, and then, we're not on your email list. Like I know Latter Rain's not on most people's email list that's here. And Latter Rain's been in operation since 2009. And we've had recovery housing since 2016. And so even being able to work with other organizations to help us to grow, or either, like I said, boots on the ground, even with the assessment, not even knowing that the assessment occurred until I came here. And then it was like, oh, there's an assessment that took place. And then looking at the numbers, how many more people could have been impacted, or how many more responses could you have gotten that would help to say, where does these dollars really need to be utilized? Not just in the major organizations that have been receiving funding for long periods of time, but how do we begin to be a part of that network and getting in and finding out someone sending out. There's multiple recovery houses or recovery programs in Kalamazoo or in the county. but they're not able to get this information.
Thank you. Thank you for that. It leads me to, Dr. Nettleton, you had mentioned the opioid coalition, and we have some, ISK partners here that help to guide that work. Is that another place and another resource to help us sort of connect better as county government with grassroots organizations and to maybe dovetail some of the work? I mean, you all have been in some background with the opioid coalition. It's a broad coalition of, many sectors, from law enforcement, prevention, intervention, recovery providers, harm reduction, medical facilities, education is at the table, a variety of sectors. And you've been working on a strategic plan. There's been one in the past, and you've just updated a strategic plan, a 5-year plan, correct? Provide some about that for us.
That absolutely is what, we are just about to finalize our strategic framework. Our last meeting was trying to put the cherry on top. Some of our subcommittees are doing some sub-analyses. I don't know if Kendall, if you want to weigh in or not. But what I think may be helpful is at our next meeting, having maybe a 10-minute presentation about, hey, here's what the KCOC has outlined as our strategic plan moving forward. We can maybe print off the finalized document when that is. And so we're not going to go line by line, but just a broad overview of what we are trying to do between members of the coalition. And that may provide opportunity for discussion and alignment for this body.
Now, would you like to chime in? I saw you nodding yes, so no pressure, but if you'd like to share, please do.
Hi, thank you so much. So we have done a lot of work that I would be happy to share with everybody at the next meeting. I think that it will help answer a lot of the questions that have been posed, as well as give some clarity on kind of how everything looks right now in our efforts moving forward.
Right. So I think that's some important work that's been going on, and there's engagement with grassroots organizations, but we certainly don't always have everybody at the table. And, making sure that we're seeking ways where people haven't been participating, that we give them opportunity to do that, right? Okay. So, Mr. Gladstone, yes.
Extra mic is on. There we go. Thank you. Yeah, Kendall's done great work of meeting with the subcommittees, and there are a lot of good people on the subcommittees that could help spread the word. This goes back to what I brought up at the last meeting with the communications problem, because we can't get the word out to people about things. So we have identified the problem. Now, some proposed solutions might be to utilize the networks for a longer period of time. So bigger grant window, a bigger grant window. So you're not just saying, a lot of times the county will come out with a grant, RFP grant or whatever, and it'll be a short window. Your proposal, by the time I find out about it, your proposal needs to be in by April 30th. That's too soon. Maybe a longer window of time. Say, okay, we're going to have low barrier grassroots points of entry for grants. We're going to let the open window be open and running for 6 months. Then utilize the various networks that we have with the coalition and other organizations. There are some faith-based organizations. We could just start putting the word out. I'm picturing the McDonald's model, where they're not really in the restaurant business, they're in the distribution business. They drop the McNugget in the chain and it goes out to every single place, but it takes time to do that. So that's why I said we need to take a better look at what main entry points to communications would look like. So the Opioid Coalition would be one of them. I'm trying to remember the name of, what's the name of the faith-based organization that does, Isaac, thank you, does a lot of work in the community, Isaac. So we have these high-level points of entry, and we drop the McNugget in the chain and let them get the word out on the street with a longer window of opportunity to apply, so you don't miss the date by the time you find out about it, and then make the application process very simple, like maybe 2-3 pages of a request for, whatever we decide to recommend on amounts, say, up to $10,000 can be requested with a simple 3-page form, and you have a large window. So those would be some proposed solutions to the problem to get the word out. Identify those key players and make it simple for people to be able to get in on an ongoing basis. Make sense?
Yeah. Right, thank you. Yeah, absolutely, April.
I think one of the things I want to speak to again is the cultural differences when it comes to grassroots organizations. A lot of times the mentality with some of these marginalized populations is that it takes a village to raise a child, right? So there'll be organizations that will be established. Oh, I have the faith to jump out there and try to get this 501c3 and do this. But a lot of times, even with Hope Through Navigation, a lot of times there's one single individual that has the vision, and a couple of people will come along and try to help birth that. Even in doing that, there still is a lack of understanding of the infrastructure that is required to be able to do it. So in my point of view, what I believe is necessary is somebody that is willing or appointed to go out and do some training, to do that one-on-one type mentorship, so that when you're writing a grant, you also know when you write that grant, there's going to be interim reports that are required, and they need to look like this, because I can jump out there, but once I get out there, I may not understand that there's a tidal wave that can carry me away, and then all of a sudden I am blackballed because I didn't understand the details of working that out. So I do think that all of this is great, but again, when we're dealing with a marginalized population, we need to take into consideration that their starting point a lot of times is way further back. And so the step ladder has to be higher, but also the tree has to be straightened so that they can get to the fruit. Thank you.
Thank you. And Ms. Davis.
One of the things I've been noticing just in trends when it comes to some bids and grant opportunities and working with foundations is also really encouraging organizations to work together and have that stronger foundation. So you've got some smaller grassroots working with a little bit larger organization, teaming and partnering, as well as with some of the foundations. They have their grant cycles. And so when they are, and they also have identified areas that they are interested in funding. So like we are getting ready to submit a grant to the Gilmore Foundation. We know we're shooting for the May 1st entry. And so we've been planning for a few months on what that submission will look like. So kind of looking at what is out there, how systems operate, and taking the best of all of them and really partnering as a community to work together. And some of it I think will really come from based on the needs inventory and surveys that have been done, and really looking at where do we, again, need to target the funds, because when we look at the funds spread out over a lot of years, it's not a lot of money.
Certainly not enough for how big the problem is. And in our community, it's a very big problem. Mr. Obram.
I just wanted to reiterate what April was saying. I work for Prevention Works, which is a well-established nonprofit, and we work a lot in the communities where there are grassroots nonprofits that have great ideas, but there's one or two people on the team, and they're like boots to the ground. They have the relationships, they're making a huge difference, but they don't always have the support to do all the administration work, and they end up in situations. So how do we partner organizations that have a well-oiled machine, know the reports, know how to maneuver the grant writing, some of that stuff, and kind of balance and work together on some of those initiatives, because I think that's really important. And I know in some of the communities that we go in and we might do a small program. Other nonprofits are in there doing similar programs, and they've asked us to step in. We are not at a place where we can do all of that yet, but that is something that Prevention Works wants to be able to do, because we do have some science and evidence in what we've been doing for years and what really works and how we are able to get funding from the feds into our local community. So.
Yeah, I think, these opportunities about how we collaborate across the system, are really are critical, and they can be a real chance for us to grow capacity in the community and connect to the grassroots. Mr. Gladstone, did you have additional?
Thank you. Excellent points brought up. The idea of mentors is a splendid idea. Perhaps, just a suggestion, looking toward a solution to that, perhaps we could utilize our universities in the area, and maybe Kendall, her department could organize a group of students who would be educated on the process and then sent out to work with some of the smaller organizations as a mentor. And then, next step, we've talked about this on the state level, operating in silos. How about we reward collaboration? So usually organizations, nonprofits are competing for a grant. Instead of competing, how about you get a $10,000 grant if you do it alone, you get a $20,000 grant if you actually can demonstrate true collaboration, not just I worked on the flyer and you posted it out on the street. No, I'm talking about, integrated work together. Kind of like what Hope Through Navigation did with COPE Network when we had the fentanyl crisis last fall or wherever. They joined together and instantly had about a dozen pop-up locations to distribute Narcan. Nobody was thinking about, well, you got this grant and I've got that grant. They pooled resources. They were on the news about it. It was a splendid collaboration between Hope and COPE, and just true collaboration working together. So reward for collaboration would be a key point for the record, and perhaps mobilizing some mentors. And we could perhaps utilize our student population.
I think I'm going to move us forward into the agenda a bit as we're getting through time here already. But we have some examples where we've done the United Way and some grassroots organizations on our gun violence intervention work. So there's models and opportunities we can use. So let's go to item 6, some discussion. One of the first topics I wanted to touch on is the compiling ultimately of the report that this body will need to present to the Board of Commissioners. And so really, how do we generate that report? Who will author that report for us on our behalf? And I just want to confirm or clarify with this body if we're comfortable with delegating that work to Administrator Smith to help us sort of combining the dialogue and documenting our ultimate recommendations, or if we have other thoughts or suggestions. Okay, seeing none, that seems like
Point of
pretty straightforward.
clarification.
Yes.
This
Mr.
is,
Gladstone.
you said we're doing ongoing work, but we're going to want to report to the board periodically, and we're looking
Well,
for a method of doing that.
Ultimately, we're an ad hoc committee. We're tasked with answering the questions within the enabling resolution. And those findings then need to be reported back to the Board of Commissioners. That would then end the work of this task force unless the county board tasks us with additional efforts that they'd like to see us engage. All right, so we had lengthy discussion last time around the needs assessment. We've had some again today. I want to bring us to question 2, which is some, targets about low-hanging fruit potentially. So where should the county board concentrate funding towards opioid remediation in the next 3 to 5 years? And number 3, what funding categories should be created based on the OCNA, so our needs assessment? I think question 3 is a little easier to answer for us when we think about some buckets that we're going to create, broader categories, but then really specifically where do we focus in the shorter term, next 3 to 5 years. This may be where more review of the strategic framework that the coalition is building could be really helpful for us. But I also wanted to just open some dialogue here around first thoughts of that, and we can dig more into sort of the framework we see from the coalition. So what's standing out to you as the most pressing needs or the categories of focus? Director Gray.
Since you said most pressing, I wanted to put my hand down, but I tell you something that stuck out with me last meeting that we probably need to enter in here is stigma reduction. The idea that these are human beings that have this issue and they span across all class, all profession, all color, all race. And that stigma reduction is extremely important because everyone needs to be seen as human and not just a junkie.
Thank you for that. Sheriff Fuller.
Thank you. So I agree that we need to address the stigma because if we're not able to do that, we're not going to be able to help anybody. Our community needs as much help as the individuals who have come into, the need for help with an opioid addiction or substance use disorder. And what I'm listening, saying we should do this and we should do that. I'd like for us to consider a listening session from our community. We recognize 600 people did the survey, and that's awesome. Huge number actually compared to a statewide version. But I've already been taking requests from sheriffs in the area. What are we doing in our county? So they need to know what they're doing. And also law enforcement community in our county is starting to ask, what are the dollars going to be used for? Is there anything that we could utilize? And so the message I sent out just this morning to the agencies in this county is, if you have ideas, you need to be here at the open sessions or the open mic time to talk about what you think you should have. And we recommend also that you come in partnership. I know that the most successful programs that we write are with all of our partners. So I would say have a listening session so people can come in. I love the idea of making, groups understand that if you collaborate with somebody else, you go higher on the list. That makes perfect sense because we do see a lot of duplications. And then, a listening session that could be our whole hour of time that we have.
Thank you, Sheriff. Pro Tem Hepler, did you have your hand? Oh, thank you. To Sheriff, thank you. Thank you. Ms. Henry.
So at the last session, the thing that was not mentioned was housing. So in my experience is that we have individuals that come into recovery housing, they go through their 15 days of treatment, which then they come into recovery housing. They're there for 90 days, or if they choose to leave at 60 and find housing, they're able to go on with their lives. But then many times when they do the 90 days, they've got to be discharged. Where do we discharge them to? What has happened is they have gone back to unsafe environments. They have nowhere else to go, which leads to relapse, which leads to them being back on the streets, which leads to them reoffending. So once they leave the programs, whether it's housing, whether we do harm reduction, where do they live? Where is a safe environment for them to continue on with recovery? So we can have all of these other programs in place and they can come and they can receive the services. But when they leave the services, they're going back into unhoused situations. So then they're experiencing the depression. They're experiencing the mental health, the lack of medication again. So we can do all of this, but we do not provide them with a safe place to land and employment. Then what we have done again is put a Band-Aid on the situation. They must have housing. And so when we talked about the task force, when I was on the housing task force with Isaac, the thing that they wanted to do is to partner and collaborate with the landlords. But the landlords were fighting so against how much they wanted to charge for a 1-bedroom for a person that's making minimum wages. But then the city does not allow more than 2 unrelated persons to be in a household. So if I leave recovery housing, I have a part-time job. I have another person that has a part-time job. And then I have another person that I may be in a relationship with that has a part-time job. We want to get an apartment together. The city of Kalamazoo does not allow us to rent together as a person's, and you talk about the stigma, and then we can't rent an apartment together so that we have a safe place to land. Plus what happens when we are persons in recovery, we're in a house together, we're able to support each other. I may have hot dogs, you got bread. I may be going through a moment with my family, you've been through that, you're able to help me. So without housing, we're putting a Band-Aid again on the solution. Thank you.
April, did you have something?
I appreciate all the comments. Again, I think a house with not making it into a home is a problem. And so you could have housing, but you're still dealing with that stigma that who's going to come in and set up the system so that we can operate and function in a manner that allows us to have recovery, right? So when we're talking about being able to deal with this opioid situation, it's all of the factors that we're talking about. And whenever you establish something, there has to be a foundation that you can build upon. It's not okay to have a recovery home with people in it, but no structure, right? So you have to have the structure. You have to have someone that is not worried about what I look like when I come to the house and I sit with these individuals and I start talking about the steps, or I start talking about how disconnected you are from your family as a direct result of your disease of addiction, right? A lot of times it still comes down to the stigma. People want to be able to help, but they're still in fear of coming in that sort of close contact with someone that is an addict. And so I believe that as we grow and as we continue to make this bridge something that is not going to be hit by a boat with containers, right? As we build this bridge over troubled water, I think that it's very important for us to take all of these things into consideration. Because there are people that have rolled up their sleeves, have gotten out there and done the work. I think those individuals should be able to be rewarded with the funding to continue to be of assistance. But still, the housing is a big deal. But when you have the housing, who's going to set up the system that works, right? If there's no system, when a child comes into a foster care home, there's already a family in place. There's already a system. And so this is beyond just how many landlords we can get. We need, like your system, Abigail Housing. We need a system. We have the men's recovery home. There's not enough of them, right? And there's not enough of us to be able to go around and build that system. So I'll pass with that. Thanks.
Thank you. Chair Ray.
Thank you. I just want to add, I think there should also be a focus on youth, both prevention and recovery as well. I don't think there's a lot of focus or emphasis on the young people who are addicted, and there should be some focus on that as well.
Ms. Sanders.
Just one last comment. It really was the one that I intended, but you stirred something in my spirit. I want to come to that mental health piece because I know in the assessments report, we talked about our first responders needing to be in a position where they can sort out or debrief or get the mental health that they need, the services that they need as a direct result of being in contact with overdose individuals. Me, myself, my lived experience, yeah, everyone I came in contact with ended up living, but the impact on that, of my life was very detrimental, you know? And so it moves you into a position where, yeah, you're passionate about it, but how close do you want to become? Because you know overdose is possible. And do you know how to use the kit, the Narcan kit, right? And to be able to administer it. It affects our first responders. It affected me, so I know it does them because they deal with it on a day-to-day basis. So I would like to see something set up where You know, when I go to get mental health services, I'm not having to deal with the stigma. Why do you need mental health services? You're in this field, don't you know that comes with the territory? It can tear a person to the core. It can tear you down, having a life slip through your hands and you were there doing all of the right things. It can really tear you down. And then it has an effect on our community where people don't want to continue in the field that they've studied to do all of their lives because they've had one life slip through their hands, and that impact has destroyed them, their mental health, their families that have supported them all of these years. It definitely is something that we don't want to overlook. As long as we have the funding, we don't want to overlook it. We want to make sure that they can have a safe haven and a place to go to recover from the direct impact of being first responders.
Yeah, it's heavy, heavy work. Thank you for sharing your experience too. Honor that and hear that. I think too, I continue to hear this gap in housing. I've heard Administrator Green lift that up as well. I've heard colleagues at the regional level lifting up that lack of sort of recovery housing. I certainly agree with the youth focus. And I think harm reduction too, I think there's real important work there, particularly around clean needle exchange programs. I think that provides a benefit in, reduced disease transmission, the opportunity for first responders also to be, exposed to less risk, when they're interacting as well. So I think that's just there's lots of areas we need to work, but I think that's another one that sort of getting that Narcan out into the community. Where do we get more points of contact for the community where when there's a crisis, they know where they can get their hands on it and, avoid losing somebody when we can, getting that out to the community. Mr. Gladstone.
Thank you. I'm quite moved by what I heard because I can relate to it. Being a person in long-term recovery, I've witnessed a lot of folks go through the trauma of not having an appropriate place to live. And where do they go? And the stigma piece ties right into that because what we hear a lot is we don't want those people in our neighborhood. And what they don't know is we're already in your neighborhood. We just need a better place to live. We're out there already. So we say we don't want those people. We're already there. The question is, do you want them in a stable environment or do you want them in an unstable environment? But we're already there. We're already in the neighborhood. But we do need to work on stigma concurrently with every other program. So if we're going to do a housing program, there needs to be the stigma reduction piece right on top. It needs to be part of the presentation. If we're going to do Narcan, I know Nancy King does great stigma reduction stuff when she's doing a Narcan training and goes through it with law enforcement and so forth. We need to keep that process going concurrently. When I make suggestions, I never say, well, we got to do one thing or the other. I think things can happen concurrently at the same time. But housing is a huge one. And we have to get past we don't want those people in our neighborhood, because I know people who have tried to start recovery houses who've gone through the process, and there is an incredible amount of hoops to jump through. And what kind of impact can this task force have through county government and perhaps influencing city government to make the changes necessary in whatever needs to be changed, whether it's zoning or all of the hoops that people have to jump through to open a recovery house. I know there's a gentleman right now based out of Lansing area who's trying to put in a big men's recovery house, apartment-sized complex, and is running into roadblocks. It's not open yet. It should have been open yesterday. There was a neighborhood association fighting to keep, quote, us out on a piece of land that nobody even wanted to begin with. But we don't want those people in our neighborhood. So I don't know what we can do about that, but we need to do it. We need to do something about that. I don't care if we need to hold a news conference and a series of news conferences, whatever we need to do. That needs to be addressed. That needs to get out there as part of the stigma reduction that, because people, there's 50% of the people are divided on any side of any issue. So you're gonna have half the people saying, now we're giving them free housing? Now we're giving them free needles? That's absurd. They don't know the background. It would break the stigma and understand why, the why of it, and then, okay, it makes sense. But when they just hear the headline, you know, we're giving away free houses or giving away free needles, they just see the headline on a particular news bureau, and that's all they have to go on. So sorry for being a little wordier than I'm wordy to begin with, but we would be a little more wordy about it. But the stigma reduction piece, I've been on that soapbox for the last 19 plus years, and we need to break it. And that's got to happen so we can get the housing, so we can get the needle exchanges, so we can pass 2 House bills that are harm reduction bills right now in the state of Michigan, and another one for insurance coverage.
Thank you. And I'm a wordy person too, Mr. Gladstone, so I understand. All right, so we're about at our time here already today. So we've had really good, compelling discussion. And we have more time to sort through our strategies going forward. Want to touch on topic number 7, if we can briefly. This is just some discussion strategy. So I don't think we finished discussion on items 2 or 3 today at all. So my expectation would be to convene that, and then to convene on that again next time and elaborate a little bit further, potentially have some discussion with the coalition and their strategic framework. And then I want us to think next time on what are some strategies that we can use to best tackle our next coming questions, which I think I identified looking at our list, not necessarily tackling them in order. I think the next ones is, again, how do we look at that community-wide prevention and education campaign? So we're going to focus on stigma reduction. How do we really address the way that we're going to do that? What about a countywide alert system? So we have, you know, mass overdose events that are occurring, or there's other issues. What sort of frameworks are already in place, and how do we utilize resources maybe through the emergency manager's office, sheriff, to help get information out into the community quickly? And then what are the additional locations or access points that are needed for those Narcan distribution? Mr. Gray, Director Gray, rather.
Yeah, Chair, I need a jet. I need to be in a Zoom for strategic.
Absolutely. Thank you so much for being here and being with us and contributing today. All right, so those will be questions we're going to work to tackle next time. I think we're going to bring questions 2 and 3 back up for some further discussions at our next meeting. Do we have any other suggested strategies that we want to lift up today while we're with one another before we convene for next month? I know everybody's got, yes, Director Rutherford.
Just real quick, I appreciated what Dr. Nettleton had discussed about the other opioid coalition. There's a rich history of a lot of good work that has gone on for, you know, quite a few years. I think it would be, because I've in my mind, I've tried to envision how these 2 bodies are going to work together and kind of pollinate off of each other. So I would, at some point in time, certainly at your consideration of having a presentation delivered so that they can identify, you know, what they do, what the history is, some of the work that they've done. Because as I've said before, this is something that many communities don't have, which is that existing work that, again, is going on for, you know, six plus years. So hopefully we can try to figure out how to marry, you know, this group and that group. Thank you.
Thank you, Director Rutherford. Pro Tem Epler, yes.
Thank you, Chair. Maybe in coalition with what Mr. Rutherford's saying is we already have several things in place in the county or that are being worked on, working through our community corrections. Our ISK has put things in place for a lot of things that may be a presentation to help this whole group understand that the county's already working on a number of things and that there's a number of things, our sheriff's departments, our law enforcement, our firefighting folks, oftentimes going to these things, are working to try to help get these people the help they need, get them to the places they need, and maybe a presentation to this group of those resources that are already there, where county's already working on we've been working on housing. The city's been working on housing. We partnered with them to do a number of things. So I think maybe there's a lot of things out there that we're not seeing that already exist. We just need to help expand them and bring them forward to help this thing and the things that we might do to help them blossom.
Absolutely. Thank you,
And I
Commissioner.
want to leave you with one
Yeah,
thought,
please.
that we need to learn to live together as brothers and sisters, or we're all going to die together as fools. Martin Luther King Jr.
Amen to that. That's good. I think, and that's the struggle with system change and collaboration, right? So I thank everybody for their time and contributions again today. Do we have any other last thoughts that we want to lift up? All right. Thank you for taking time and your efforts. We got good work in front of us to continue. We're adjourned.